If you're a parent and have a child who is 8 or 9 year old, and all of a sudden you see them growing taller, having peculiar body odor or secondary sexual characteristics, then the child might be going through precocious puberty, and this video is all about that. What is it, why it happens, and what can Ayurveda help you to prevent it with? Number one, what is precocious puberty? Usually in girls, the puberty or sexual characteristics start between 10 to 14 years of age, and for boys between 12 to 16 years. If it is happening before 8 years in girls, and if it is happening before 9 years in boys, then it is precocious puberty. What are the signs? For the girls, breast budding, secondary sexual characters coming before the age of 8, all of a sudden gaining height, a very bad body odor, cystic acne or pimples, and sudden growth spurts, and also mood swings. If you see these signs, kindly visit your pediatrician to rule it out. What are the types of precocious puberty? One is central, one is peripheral. 90% of the girls go through central, where the cause is not known. It is idiopathic, or it could be due to tumors in the brain. And the peripheral, it is due to sudden sex hormone surge without the brain giving signal to the body. It could be due to ovarian cyst or adrenal glands which have suddenly grown a bit in boys, and that also has to be ruled out. The other part is lifestyle and food, and that is what you can manage from your side as a parent, and we will discuss that. Cause and prevention both. In girls, if they are putting on weight or they are obese, excess fat can lead to production of estrogen, also production of leptin, which signals your brain to produce sexual hormones, leading to early puberty. Same happens with boys. So try and give them healthy food and see to it that they do not put on a lot of fat. Don't expose your children to EDCs or endocrine disrupting chemicals, which could be present in plastics, fragrances, in thermal receipts, and pesticides. These are BPAs and phthalates, and they disrupt or mimic estrogen in the body, leading to early puberty signs. So avoid plastics. Do not give anything with fragrance to your children. Do not let them handle thermal receipt. If they are doing so, let them wash their hands, and ensure the food that is coming to your house is pesticide free. If it is not so, just clean it well with tamarind water or salt water or baking soda. It really reduces pesticides in the food. Reduce processed food and sugar. They also disrupt a lot of hormones in the body. Apart from that, screen time and too much access to content which is of adult kind. So screen time post 7 or 8 disturbs melatonin production. Melatonin is a sleep hormone, and it also helps produce good quality hormones from the brain, especially sex hormones. If melatonin is disrupted, you will disrupt all the other hormone cascade. तो देखिए कि आपके बच्चे ज़्यादा रात को screen time नहीं लें, and keep a watch on what kind of content they are watching, because that can mess with a very early childhood. What does precocious puberty do to children? They might have mood swings. They become adult a little early and they don't know how to handle it. And you need to handle it with a lot of love and sympathy and empathy if it happens to them. But how do we prevent it? First things first, let's follow Ayurveda. Be very careful and instill good lifestyle habits in your child right from the beginning. It could be oil pulling, which improves their oral bacteria and digestion. It could be nasya, which really nourishes the brain and hypothalamus, improving hormone production. It could be pranayama, breathing in, breathing out, because it really reduces stress and anxiety in children and helps good hormone production. And abhyanga, or application of oil at least once in 15 days as a ritual. If not so, let them apply oil to their sole and earlobe daily when they go to sleep. They will sleep sound, they will have better energies, and they will be very positive and happy kids. Foods, sugar आप कम कर दीजिए जितना हो सके उतना. Reduce their dairy intake. आप मिल्क दीजिए 1 से 2 ग्लास इन अ डे. दही से अच्छा है कि छाछ दें. Buttermilk is good for them. Lot of fruits in the dabba, good vegetables. and ensure that inka exposure to sugar is less. What has happened in Indian families now is there's a lot of celebration, and it is sweet, chocolate, and there are hidden sugar and salt in your breads, cookies, in so many things which come from out that you need to avoid that. Apart from that, exercise. Teach them that bahar jana hai, 15 minutes sunlight leni hai, and work out for 30 minutes. Let them play, run around. That will keep their hormones in check. And maintain a sleep hygiene. Early to bed, early to rise really helps with people who are genetically prone to precocious puberty. So these are the things that you can do to them. Apart from that, introduce them to Chyawanprash or Amla early. It helps balance hormones and nourishes their body and mind both. I am Dr. Manisha Mishra, and I talk about herbs, Ayurveda, food. Share it with somebody who might need to know it, and subscribe my channel for more Ayurveda content.